A new CNN survey shows most Americans are still opposed to President Obama's health care reform bill. 54% of those surveyed say they are against Obamacare. About 43% support the law. Those numbers are relatively unchanged since Congress passed the law in 2010. Even though the law is set to take effect next year, nearly half of Americans don't know the law still exists. Jennifer Wishon looks at what we can expect.
It's supposed to create jobs, provide health insurance for all Americans who want it, and save money. Instead, the Affordable Care Act for many Americans has already become a source of heartburn.
This is legislation that was 2,500 pages long, now 20,000 pages of legislation.
That's 17,500 pages of new regulations written by bureaucrats on top of an already complex law passed by Congress. And for employers who have no choice but to understand the nitty-gritty in order to make decisions for their companies, the task is overwhelming.
For example, there is the employer mandate, the requirement that businesses with 50 or more full-time equivalent employees provide health insurance or pay penalties. That was a 3.5-page provision that got turned into a 144-page regulation with 44 definitions.
One study predicts Obamacare will put more than 3 million jobs in jeopardy. For now, confusion and uncertainty about the law is stifling economic growth.
So there's a lot of heartburn right now and a lot of nervousness about what exactly the increased costs will mean for their bottom line.
President Obama maintains that Americans who like their insurance plan can keep it, but that's not turning out to be the case. According to a study of 11,000 plans on the individual market, less than 2% comply with Obamacare. That means 98% of plans must change, or the people using them must find new plans. And the Congressional Budget Office now estimates Obamacare will result in 7 million Americans being dropped from their employers' health plans and forced into new health exchanges set up by the law. It's true more Americans will have health insurance under Obamacare, but that will lead to greater demands on the health care system. And therein lies another problem.
We know that the government's own chief actuary says that about 15% of hospitals will close as a result of this because they're no longer viable.
Still, even after all 20,000 pages of regulations are implemented, not all Americans will be insured. CBO estimates by the year 2023, 30 million Americans still won't have insurance. And by that time, America will have spent nearly $2 trillion implementing the law.
We're spending a lot of money in helping relatively few people. In many ways, it probably would have been simpler and cheaper just to give everybody money to buy insurance.
Obamacare gives extraordinary discretion to the Secretary of Health. In fact, some 1,000 times, the law gives her power to create definitions and regulations. And that's why the number of pages in the law keeps on growing. The law is so complex, some wonder if it can be implemented in January. Secretary Sebelius says it will. But many others doubt it. Even some Democrats worry it will be tough to get Obamacare to work and fear it could become a political liability for them in next year's elections. Jennifer Wishon, CBN News, Washington.